What if you could monitor residents 24/7, reduce emergency calls, and improve care without adding a single staff member? Today's guest secured a $600,000 grant to revolutionize how rural senior living operates, and you won't believe the impact it's making. Let's dive in.
Welcome to From Leads to Leases, a CCR Growth podcast that helps senior living providers transform their complex challenges into opportunities. Listen in for stories from industry leaders, innovative strategies, and insights. And with our expertise, learn how to increase occupancy faster, guaranteed.
Welcome back to another episode of From Leads to Leases, the podcast that dives deep into the senior living and senior care industries, bringing you insights, strategies, and stories from the experts at the forefront of marketing and sales. I'm your host, Jerry Vinci, CEO of CCR Growth. For those of you who don't know about us, CCR Growth is a full-service marketing and growth agency exclusive to the senior living industry. And at our core, we help providers achieve three things. Number one, we deliver higher qualified leads that convert to tours and move-ins in less time. Two, we help reduce or remove the reliance on paid referrals, significantly reducing your cost per move-in. And three, we measure, optimize, align, and integrate all of your marketing and sales systems to track crucial data such as acquisition costs or the length of your sales cycle, helping your communities make more informed decisions that positively impact growth, sustainability, and profitability. Through this podcast, I'm here to guide you through the evolving landscape of the senior living industry, helping communities connect with the families and residents they serve in more meaningful and effective ways that impact your bottom line. Today, we're joined by Shanna Eckberg, CEO of St. John's Lutheran Community in rural Minnesota. With over 25 years in senior living, Shanna has held leadership roles at every level, from administrator to COO to CEO. She's a passionate advocate for improving company culture, strategic planning, and leadership development. Shanna's latest initiative is a groundbreaking remote patient monitoring system, a project backed by a $600,000 grant to help seniors stay in their homes longer while staying connected to care providers. In this episode, we'll discuss the challenges of rural senior living, how tech is solving staff shortages, and why company culture matters more than ever in senior care. So, Shanna, welcome to the show.
Oh, thank you. Hi.
It's great having you here.
Thank you. I'm excited.
There's obviously a lot to cover, and I always enjoy starting out with some of your background information. So you went from a high school job to a CEO. So in those 25 years, can you share a little bit about your journey from food service to CEO?
Sure. Yes. So I transitioned from working at a grocery store to a senior living community when I was 16. Truthfully, it paid a little better and the hours were a good fit. So I jumped. The people that I remember being trained in by, they were amazing and just taught me a lot. And so when I was going to college, I went at night and online. I needed to work full time because I lived on my own. So at the senior living community that I transitioned to, I was a cook, receptionist, and a dietary aide. And actually the administrator at the time had said, hey, there's a job you should apply for at our home office. So that was in accounting. It was accounts payable. And while I was there, I finished my degree in long-term care administration. I was actually standing, I remember the moment, I was standing at a filing cabinet and I said, I really want to be back in the community with seniors and the teams that were there. And so I was like, this isn't for me doing this. So then I finished my degree. And then I was offered an interim administrator position, actually where I started as a cook in food service. So that was pretty great to work with some of the same seniors and the staff. And then I grew within the organization. I was the administrator there for 7 years, promoted to executive director at a larger campus in Wisconsin, grew into a vice president of operations role, promoted to chief operating officer. And now I'm in the role I'm in as a CEO at a rural standalone multi-facility community.
That's quite the journey.
It is.
So I mean, what drew you to leadership in senior living? And I know, given all those different roles, your perspective has probably changed throughout those different levels of working in the industry.
Yeah. So I think I really had to think about this one. I was drawn to leadership, I believe, because I want to serve others. And the teams that all want to serve seniors as well, like I'm just drawn to that mentality. And so I believe that I had a good mentor who potentially saw that in me and really helped me to learn how to become a leader. So the perspective side, it's really continued to grow, to appreciate more and more the seniors who call these senior living organization communities, like they call them home, and the staff that work there,
Sure.
because it is people's homes that we work in. So just continuing to develop my own emotional intelligence and listening skills. I remember being a dietary aide, and it was so important to remember what somebody liked to eat or when their family came. And it's like, that still matters today. That stuff never changed. But when you go from, working side by side with a team member, and I grew into different roles, I never forgot what those people like to eat. It's those little things that truly matter and help you to stay grounded, and why we do what we do every day.
When you have worked through all those different levels, there's a lot more intentionality in the work that you do. Even in my business as a marketer, I started out doing everything, right? I was wearing all the hats. And then over the last 21 years, we've built our agency up and we've brought in experts around every position. And it's been nice because I have that baseline understanding of what it's going to take to get the results that we need. And then I'm able to work with my team to make sure that we're all on the same page. So I think that kind of goes back to what you were saying too about building a strong company culture. When you understand what's at stake for each of those positions and how those people should be showing up to work with residents and with family members and with other staff, I think that's super valuable. So you're our first guest who's actually operating a rural senior living community. So I think this is an important conversation because I know there's a lot of operators out there that it is challenging and there's unique challenges to that situation. What are some of the biggest operational hurdles that you've faced compared to urban communities or even suburban communities?
Sure. Yeah. I would say that the biggest ones for rural would be access to more options for healthcare, meaning we may only have one dentist, telehealth, mental health opportunities, so those I think are huge challenges because our residents that move in, they have needs too. And so how can we meet those needs? So I would say access to more options for healthcare, mental health opportunities, super important, and access to people to provide services in our organizations. Those are big for us.
Yeah. Staffing is a challenge everywhere, I would say. Would you say, especially in rural areas, that's the case? And then if that is, what would be a strategy that's worked for you in recruiting and retaining top talent?
Sure. I think truthfully, yes, it's a challenge. I think it's similar everywhere, and we feel it. We feel it even when you go to the market yourself. So strategies that we found successful would be ensuring that you have metrics in place to track your progress. What do you want to focus on? You have to have a goal. So for us, it was really saying, you know what? We need to have a solid process in place for recruiting new team members, making sure that we pay competitive wages, and again, going back to culture, creating a fun and positive place to work. Simple, but it's very important to have a focus and ways to measure those things.
Oh, that's good advice for sure. In terms of acquisition of residents, I know most communities, it's typically maybe a 5 to 10 mile radius where probably 85% of their residents typically move in from. What does that look like in a rural community?
Sure. So for us, our market that we may pull from extends even outside of the county that we reside in. And I'm assuming many other rural organizations have that same thing.
Yeah.
Depending on how close they are to an urban location. So I would say upwards of 40 to 50 miles sometimes we pull residents from.
Wow. Okay. Yeah. So that obviously, like you were saying, with there being limited access to certain doctors and other professionals in your area, that's got to be a challenge or struggle for residents sometimes to adapt to change, of having to maybe give up a provider that they're used to working with because they can't drive 50 miles to go see somebody anymore.
Exactly. Yeah. Good point. Yep. Exactly.
Yeah. One of the great things you've been able to do is maintain strong occupancy in your communities while I think a lot of other communities are struggling. What do you credit that success to?
Yes. We really have a nice organization that offers a variety of services to seniors at two locations, and it's a full continuum, meaning there are independent living options, assisted living with memory care, and then also a skilled nursing facility, which offers therapy services so you can go home and continue your outpatient services. So I really think that it's partially our diversity. We also, you being in the marketing world, we put a focused effort on response times to our referrals, to our leads. Super important. Our company culture, we understand that it's a crucial part of your organization. And so as we make sure that we have prompt response times, these are part of our goals. And so all of these goals flow into our meetings. We have our occupancy percentage on a performance dashboard that's shared with employees and our board members.
Everybody's kind of aware of what's at stake. I think that's really important. I think more organizations should really share that census information. Last time we talked, one of the things we talked about was the remote patient monitoring. I think this is such a cool concept. So how does that technology work, and why did you decide to implement it in your communities?
Sure. So remote patient monitoring is a big term. It can mean many different things, and it's been around for a very long time. So years and years ago, I've always been drawn to it when the technology started coming out, in how can it help us do better? I cannot, as one caregiver, get to all 20 people at night to make sure they're all doing all right. But now there's technology that can help us. So specifically, we've partnered with Zemply, which is a technology company that offers the remote patient monitoring with an AI platform working behind the scenes. And we all hear about artificial intelligence, or AI, a ton more now than we did 3-4 years ago even. And so motion sensors are throughout the living areas. Vitals are taken wirelessly and uploaded into the software. And then a bed or chair mat, depending on where we put it, tracks oxygen levels and respiration rates. And so that happens all the time. And the vitals are taken daily, if not more frequently, if we notice a variance from where it should be. So we decided to implement it because it's a tool. It's to help improve the quality of care to our residents. Doesn't replace people. It strengthens what we do and expands our services to best meet the needs of those who are in our care.
I love that. Integrating any kind of technological solution or anything like this. I mean, many providers, they're often worried about cost and implementation. How does your remote monitoring system remain affordable and effective?
Sure. And when I first started looking at it, there were limited options and very expensive. So it's really important, you'll hear me say this, to find the right partner who understands senior living. The way that we get reimbursed for care, and someone who's willing to learn with us. That's what we have found with Zemply, is that an understanding of the Medicaid system is complicated. Reimbursement is less. And are there things that they can do to help us? And so they're helping us navigate affordability, effectiveness by like some hands-on training, weekly support meetings, working through billing, and helped us find a physicians group that actually comes into our assisted livings and works specifically with our residents and helps prescribe that remote patient monitoring. So
that makes sense. And then what impact has this had since you've implemented it on staffing efficiency, resident safety, or even a family's peace of mind?
Mm-hmm. So we're still early in our implementation. However, for the staff efficiency, we can see a more clear and a fuller picture of the resident, which I think helps. Then it also creates the ability to see when medication cabinets are opened, when the vitals are taken. So if you by chance have someone, a family member who did my loved one take their medications? And it's a simple question, but you can coincide with that cabinet door opening. Yep, it was opened. We know. And then, of course, you can check the medication administration record, but sometimes just having the technology say, yep, it really happened is helpful. And then overall movement patterns. So that helps us learn about the residents, when they might get up, when they go to bed, when they might be restless. It also should tell us early on if somebody is developing an infection or hey, this person has prolonged high blood pressure. We need this addressed.
Oh, that's great.
Yeah. Yep. So it sends alerts to you. The AI sends alerts to you and said, this is higher than it should be. What are you going to do about it? That kind of stuff. And we've just implemented, starting tomorrow, an operations review daily to ensure that we all understand what the alerts are telling us and how we're going to address those, and just build it into our daily process to help just make sure we stay on top of it. And then I had a resident just last Friday who said, his loved one is going to need to stay in the nursing home long term. And he was hopeful that this remote patient monitoring could follow her. And right now, we're limited with our physicians, so we're not able to have that transition with her. But yeah, it was kind of neat that he was hopeful for it to stay with her.
I could see why. Yeah, I was curious about if it was just giving you that layer of data, or if it was taking it one step further and actually analyzing the data to drive some conclusions forward. So that's great. Like if it's looking at someone's activity and it notices that they're not as active as they were a week ago or a month ago, it'll bring an alert and say, hey, we noticed XYZ. This is something you might want to look into. That's really awesome.
Yep. So then when we make that note in there, like more normal blood pressure is this, the AI learns. So then the next alert wouldn't happen until it was maybe above that normal, if that makes sense.
And that's personalized to each resident,
yes.
right? So
yes.
Yeah.
Mm-hmm. Yeah.
And then how do you tell it what to take note of? I mean, does that all come with it, or do you have to kind of train it what to look for, what to monitor?
Yep. So there's standards built in, but then in this situation, somebody might have a lower respiration, lower heart rate. Mine's really low. So I would be flagging every night, but then as you address the alerts, Shanna's resting heart rate is 40. Don't worry about it. This is her norm. It wouldn't keep alerting you then if that happens. But if it hits 20, problem, but that's how it works. Something. I mean, on simple terms, that's how I understand it to work for us. So.
Okay. That's cool.
Mm-hmm.
So the $600,000 grant, we need to talk about this. That's pretty awesome that you were able to do that. And that allowed you to expand remote patient monitoring and create a collaborative care model. Can you walk us through how this initiative is being rolled out?
Mm-hmm. Yes. So the Connected Community Grant, we applied for it. Leading Age Minnesota gave it to us. We are one of 3 in the state of Minnesota that received it. So the overall goal is to create a connected community of resources to serve seniors in their homes or where and how they want to age. It's very loose, but that's great because that's what counties are looking at. That's what state and federal governments are looking at. So for our project initiative, we partnered with many, many resources and like-minded groups in Freeborn County to determine, how do we start? What do we do? How can we align all these amazing things that people are doing? And through that exploratory process, it's just so cool that there are so many supportive things for seniors. So we are super early in the stages. We are conducting learning sessions with city mayors, our age-friendly group, the chamber, the fire department, and our Freeborn County senior resources to start to roll out who seniors call for help. Mm-hmm. So we have determined that really we need an individual. Some of these funds are going to go to pay for somebody to be on the other end of that phone. And a senior or their loved one would call, share their needs. We would determine how we can help. And then based on that, there are resources we can deploy, and we would see them through that process and close the loop with them being satisfied with the service. Again, kind of like a sale. And then again, we would have a specific person owning that and tracking it in a CRM to basically, it's like a navigator of sorts. I mean, that's probably not the term we're going to use, but that's what it's going to do.
I think that makes sense. A guide of some kind.
Mm-hmm.
Yeah.
Yep. Yep.
And then how do you build awareness about this? How does the community know that this thing exists?
Yeah. And I think it's going to be multifaceted, right? Because we want to hit the kids of the seniors. We want to hit the seniors themselves. And we also want to just connect with a lot of people about what we're doing. So we're going to go old school with some of it. We are going to get out to those small cities in the county, and we're going to talk about it. We are building a marketing piece, so a 5x7 postcard, magnets, QR code, and it's neat because there's a few of us, not a few of us, there's a ton of people who want to help. So, but we're going to have a focused effort on getting out into the community to talk about this specifically and how we can help. That's how we're going to do it.
Okay. More grassroots style, I can imagine that would be pretty effective. How does this tie into the larger mission as a senior living provider?
Yeah. And that's a great question. So St. John's mission is to provide physical, emotional, social, and Christian care for all people with dignity and respect in an environment of God's grace. Doesn't say it has to be done within our walls, right? So this ties in perfectly for the Connected Communities project we're starting. So I had someone who brought forward a perspective and asked a question and said, why would you want to do that? Why would you want to be involved in projects that keeps people in their homes? And I was like, I guess I never really thought about it that way. To me, like, this is all about being diversified and being able to be known as the senior living expert who participate in efforts like this, that I believe actually increases our awareness and shows that we're diversifying and that we acknowledge people aren't all going to want to live in the exact same way. And I think it's going to widen our funnel a little bit. So I don't see it as a decline in referrals or move-ins, actually.
No, I think it keeps you top of mind. I mean, if people know that you're the one creating this guide and resource for these communities, you're going to be the first one that they call when the time comes, because you've already built that trust and rapport with them. So that makes total sense.
Yeah.
I do think just in general, marketing sense to be in all stages of like the life cycle with people, whether it's the first, just awareness stage where they don't know you exist and now they know you exist, to they're ready to move into your community. I mean, if you can have multiple touch points with them along the way, some of the statistics say it's anywhere from 20 to 27 touch points to get a prospect from start to finish through from a lead to a lease. But that's if they're even looking for senior living. Sometimes they're not even looking. Like, this whole program is being built for people who are looking to stay in their homes. What was the originating idea? Where did this come from? Have you noticed that there have been more seniors that have kind of not been as change ready as in the past, and this is kind of bridging that gap?
So in all of my education studies, it's of course been talked about that the senior population, the aging population, is going to be immense. And and years ago, probably 10, 12 years ago now, maybe even more, how are we going to handle it? How are we going to build all these units? How are we going to do all these things to meet the demand?
Yeah.
But the thing is, the studies are showing us that care is less expensive in homes if we can figure out how to make it work than being in a nursing home. Plus, again, how can we build this many units every year to meet that demand? So that's why I think that doing this is the right move. We have to start speaking up about these things, and we have to start figuring out how to make it work. And maybe we'll be able to help other counties and things to see how we're doing it.
Yeah, I think that's super important. I think because of life expectancy increasing and longevity and just overall health and wellness improving for older adults too, I think most are less likely to move into a permanent senior living situation as early as prior generations. So most of my clients, the average age of a resident moving in is 80 to 84 years old, where in the maybe 15, 20 years ago, it was, 70s. So getting people to really buy into even an independent living community now at a younger age, or a CCRC where they're trying to find like younger, more vibrant adults who don't necessarily have any major health concerns yet, things like that. Getting them to say, yeah, I'll sell my house to come move into a community. It's hard to do. I mean, some of the sales cycles for CCRCs, it's like 5 years to nurture people for that long before they finally are like, okay, now I'm ready.
Yep.
It's kind of crazy.
Yes, it is.
And in terms of securing funding, what advice do you have for other senior living leaders for anything in the technology or innovation space within communities? I know that's got to be challenging.
It is. It for sure is. I just remember early on when things were so expensive, and it was, how do we pay for this? How do we pay for this? So what sticks out to me is that technology and innovation, they do have to be part of our strategic and project plans. We have to work them in. Doesn't have to be scary. Artificial intelligence doesn't have to be scary. Technology can help us, so it's saying it's okay. We'll figure it out. But I really think I go back to the like-minded partners who can help navigate funding, determine our best options for success. There can be some ways to fund it, potentially through reimbursement in your state level or in Medicare dollars. An area that I have been spending a lot of time with is learning more about our local area agency on aging. And through the state of, at least of Minnesota, they have ongoing grant opportunities to apply for. And there's one specifically called a Live Well at Home, where the whole initiative is how can we best support people living in their homes. So
sure,
just a couple of ideas.
Okay. That's good advice. We talked a little bit about company culture earlier. In terms of that, what do you think is the biggest mistake you see senior living leaders making when it comes to team engagement and leadership development?
I believe that we all face so many barriers with regulation, limitations in funding, that perhaps a mistake that I've heard would be when people within the teams don't get communicated with. And of course, there are going to be times where stuff is forgotten, but it is really important to communicate with your direct team members and ensure that there are methods on how to communicate to others on the team, because it needs to flow and in many different ways, because not everybody learns the same. I think that leads to people feeling unimportant. Another error could be not meeting with individuals who you have like a reporting relationship with on a set basis for what works for them, to discuss their development and if they want to keep growing. Not everybody wants to keep growing and learning. Like, they really want to stay in the position they're in. They're rocking it out.
They find their happy place.
Yes. And so it's like, we cannot force that just because they're a rock star and they'll do everything. But, knowing your team and what they want and how it fits, and helping them see how their role is unbelievably important in what we do. So I think that could be a potential mistake.
Having been in this industry for 25 years, I mean, I would imagine it's pretty easy for you to identify those different types of people, the ones that have the drive and the ones that are just happy with staying where they're at, right?
Yeah. And it's okay to ask, what do you want to do?
Yeah.
Are you happy doing what you're doing? Yes. Oh, that's so great. Thank you. So yeah, just ask.
One of my favorite books is Jim Collins' Good to Great. I don't know if you've ever read it.
I have.
Yeah. He does the bus analogy, and he says,
yes,
number one, get the right people on the bus, and then number two, get them in the right seats. So I think that's kind of how we operate our business too, is we know that these are really good people and we want to make sure we retain them no matter what. And then it's, once we know that that's happening, then it's okay, now let's figure out exactly what seat we want to put them into that's going to make them thrive in that role.
Yeah.
That's been so fun growing the agency and watching that happen, and people really enjoying what they do. I know we talked a little bit about kind of the future or the challenges of senior living right now in terms of seniors being change ready, or, the longevity and life expectancy increasing, things like that. I mean, with this major influx of older adults coming into the market, I mean, what do you think the next 5 to 10 years looks like for rural markets?
Yeah. And I alluded to it earlier. I think about it a lot. So of course there's changing rules, regulations, federal government administration. With that comes unknowns. So what we know as providers, as the vendors for us, we have to anticipate constant change. It's inevitable. So things are going to change, and that's okay. But we know that the people that we serve, they really do the majority based on many studies, want to stay in their homes. And in many cases, it's less expensive than communal care, such as nursing homes. So the one thing that I continually say now, way more than I used to, is where are robotics going to come in and help? Like, for example, I went through a McDonald's line probably a year ago, and I had a computer that I got to speak to, that I got to order with. And once I realized it was a computer, I had to totally change my approach. I want this, and this, right?
Yeah.
But then I was like, the order wasn't wrong. Oh, I have been telling my family and anybody who will listen that I foresee fast food restaurants using more robotics. I really do. And I think once they grab onto that, because automation could be fairly simple in some of those, I mean, not everyone, but in some of those, I think more people are going to be open to robotic support. Residents entering into our nursing homes, they're going to be complex. They're going to require complex care because, again, the people who can stay home are going to. And we have to adapt to that, and then also adapt to these, it's probably not the right term, but those who are the sickest of the sick will need nursing homes specifically for those reasons. And we will be, trained for that. What do you think?
Highest acuity, right?
Yep,
What'd
I
you
do.
say? Yeah.
Yep. And I think housing is going to grow, low income specifically, just because of the sheer numbers that we talked about earlier.
I think one of the challenges too, I mean, we have to drive down the cost of care somehow. I don't know how that's going to happen. We just keep talking about it, but everything's going in the opposite direction. But I think also if you look at Gen X and millennials, they don't have the kind of savings and funds available like the baby boomers have right now. I mean, they're holding on to, I think it's like 60% of the wealth in this country, 65%, something like that, out of everyone. I mean, that's a considerable amount. So I don't know how we solve that problem, because I mean, I'm a Gen Xer, a young Gen Xer, and like we're the sandwich generation, right? Like we've got aging parents, but we've also got younger kids. And so we're kind of caught in the middle, trying to navigate that. I think is going to be challenging.
It is. It really is. And that's why it's constant change.
I think my last question for you would just be, how can our audience stay connected with you and learn more about St. John's Lutheran Community and even this outside project, this grant? Is there somewhere they can go to learn more about that?
Yes. So we are staying active on our St. John's Facebook site, website, and LinkedIn. We're going to put this out there. And as we continue to have connected community updates, we are involving like the local media and our Leading Age Minnesota partner, and they're helping to project it out. When we received the grant, along with a couple of others, we were published in McKnight's, which is super great. So I think as we continue to,
that's great.
As we continue to have great work, we're going to share it in the best ways we can. So look to Facebook, our website, and LinkedIn.
Cool. Now we'll make sure we share all that in the show notes. So as we wrap up today's episode, I want to extend a huge thank you, Shanna Eckberg, for joining us and sharing your insights on rural senior living, remote patient monitoring, and leadership development. Your innovative approach to technology and culture is a game changer for the industry. If you want to stay connected with Shanna and learn more about St. John's Lutheran Community, visit stjohnsofalbertley.org and follow her on LinkedIn. And I have Facebook and a couple other links for you guys in the show notes, so make sure to check that out. As always, we hope you found this episode insightful and inspiring. Don't forget to subscribe to our podcast on your favorite platform and stay tuned for more episodes where we continue to explore the dynamic world of senior living marketing and sales. Also, remember that From Leads to Leases isn't just an audio experience, we're also a video podcast. So if you want to see the video versions of our episodes like the one here with Shanna, make sure to subscribe to our YouTube or Spotify channels. I'm Jerry Vinci, CEO of CCR Growth. Thank you for joining us on From Leads to Leases. Please make sure to like, subscribe, and share this episode with anyone who might find it useful. I'm truly grateful for your time and attention. Until next time, lead with strategy and with heart. Chat with you again soon. Thanks, Shanna.
Thank you.
Thanks for listening to From Leads to Leases. Are you ready to fill your rooms faster and increase occupancy? Visit ccrgrowth.com to learn about our Senior Growth Innovation Suite, a proven system to generate highly qualified, tour-ready leads, accelerate sales, and reduce acquisition costs. Let's connect and turn your challenges into opportunities. See you next time.